Naloxone is a medication used to quickly and safely reverse a known or suspected opioid overdose. Opioids can be prescribed as pain medications or taken as illicit drugs. Common names for opioids are heroin, fentanyl, hydrocodone, oxycodone, morphine, and codeine. An opioid overdose is life-threatening, and without emergency medical attention, the victim will likely die. By understanding how to recognize an opioid overdose and effectively administer naloxone, you can help save a life. There are several signs to look for in an opioid overdose. Opioids will cause the victim to become very tired, they may fall asleep, or lose consciousness. It will also cause breathing to become slow and eventually stop. Their breathing may appear very shallow, or they may sound like they are choking or gasping for air. Their pupils may become very small, to the size of a pinpoint. You may also notice that their skin appears pale, blue, or gray. If you see a person with any of these signs, it is possible they have overdosed on opioids. Even if you aren't sure, following these steps to safely administer naloxone can help save their life and will not cause harm. First, ensure your surroundings are safe and approach the victim. Try shouting, "Open your eyes," while shaking or pinching them to see if they respond. If there's no response, lie them on their back and gently tilt their chin towards the sky. This will open their airway and help them breathe. Next, call 911 for help. The victim will need to go to the hospital as quickly as possible. If you are with someone else who can help, have that person call 911. Carefully open the package of naloxone nasal spray and review the instruction card. Put your thumb on the bottom and your first and middle fingers on either side of the nozzle. Gently insert the nozzle into one nostril. Continue to keep their chin gently tilted up while you firmly press down on the plunger to release the dose. Closely watch the victim for changes in breathing. Continue to try and wake them up and encourage deep breaths. Lie the victim on their left side with their head on their arm and both knees on the ground. This will help prevent choking. Reversing an opioid overdose will sometimes cause sudden and severe withdrawal symptoms, such as vomiting and agitation. It is important to stay with the victim until emergency workers arrive to bring them to a hospital. Try and remember what time you gave them naloxone. If there was no response or minimal response 2 to 3 minutes after the first dose, you can give a second dose if one is available. Following these steps and administering naloxone will not harm the victim even if they are not experiencing an opioid overdose. Your quick and careful action is necessary to help save a life.